put his hands on him.
Today I would like to tell you all about something that, in my opinion, should be illegal in every way, shape, and form other than for medical reasons. The object that I'm talking about is steroids. Steroids were first developed in the 1930s to promote growth of skeletal muscle and develop male sexual characteristics. The short-term adverse physical effects of anabolic steroid abuse are fairly well known. However, the long-term adverse physical effects of anabolic steroid use have not been studied and as such are not known. Abuse of anabolic steroids may result in harmful side effects as well as serious injury and death. The abuser in most cases is unaware of these dangers. Anabolic steroids are primarily used by bodybuilders, athletes, and fitness buffs who claim steroids give them a competitive advantage and improve their physical performance. Also, individuals in occupations requiring enhanced physical strength, such as bodyguards, construction workers, and law enforcement officers, are known to take these drugs. Steroids are made to increase lean body mass, strength, and aggressiveness. Steroids are also believed to reduce recovery time between workouts, which makes it possible to train harder and thus improve strength and endurance. Some non-athletes also take steroids to increase their endurance, muscle size, and strength, and reduce body fat, which they believe improves their personal appearance. Doctors may prescribe steroids to patients for legitimate purposes such as loss of function of testicles, breast cancer, and low red blood cell count. Veterinarians administer steroids to animals for legitimate purposes such as to promote feed efficiency and to improve weight gain and hair coat. They are also used in veterinary practice to treat anemia and counteract tissue breakdown during illness and trauma. For purposes of illegal use, there are several sources. The most common illegal source is from smuggling steroids into the U.S. from other countries such as Mexico and European countries. Smuggling from these areas is easier because a prescription is not required for purchase of steroids. Anabolic steroids dispensed for legitimate medical purposes are administered several ways, including intramuscular injection, by mouth, pellet implantation under the skin, and by application to the skin with gels or patches. These same routes are used for purposes of abusing steroids, with injection and oral administration being the most common. People abusing steroids may take anywhere from 1 to upwards of 100 times normal doses of anabolic steroids. This often includes taking 2 or more steroids to support the other. This is called stacking. Abusers will often alternate periods 6 to 16 weeks in length of high-dose use of steroids with periods of low-dose use or no drug at all. This practice is called cycling. Another mode of steroid use is called pyramiding. With this method, users slowly escalate steroid use, increasing the number of drugs used at one time and or the dose and frequency of 1 or more steroids. Doses of anabolic steroids used will depend on particular objectives of the steroid user. Athletes, middle or high school, college or professional, and Olympic usually take steroids for a limited period of time to achieve a particular goal. Others, such as bodybuilders, law enforcement officers, fitness buffs, and bodyguards, usually take steroids for an extended period of times. The length of time that steroid stays in the body varies from a couple of days to more than 12 months. After all the information I have gave you today, I hope that you too can see and understand why using steroids for more than medical reason is cheating yourself, considering that it is no more than an enhancing, addicting drug.